what the graduates practice. What other field would be under so much government control? Certainly not slip and fall lawyers. Senator. Do you support the passage I've quoted from page 881 from the bill?
Yes, run it.
What was the question?
Do you support a demonstrated record of, do you support giving medical schools increased grants and federal contracts if they have a demonstrated record of training individuals who are from underrepresented minority groups?
Well, I understand the question. When you talk about underrepresented groups, which you're talking about affirmative action, or you talk about sending the graduates to underserved areas, I don't think they ought to control. I think there are factors which ought to be considered. What I'm trying to do is see more medical schools in our country. Right now, you got some excellent care here from Geisinger, but we're trying to put a medical school into Scranton. And one of the considerations which we're looking for, frankly, on applicants to Scranton, will they stay in the area? When you make a big investment in medical training, you don't want to make them a slave and make it binding, but we like to encourage them to stay in the area. There's an interest in having a medical school at Franklin and Marshall for Lancaster, and I think that is useful. To encourage people to go into underserved areas, I think is also a good point. I wouldn't say it's an absolute. I grew up in a small town in Kansas, same town that Bob Dole comes from, a little town, 4,998 people, used to have 5,000.
Talk about avoiding the question.
Yeah, really.
And there's only one doctor in town. It'd be nice to have a second doctor in Russell. But I'm glad you're going to medical school. And it's a better place to go from what I get in the crowd today than to go to law school. Who's got number 3? Yes, ma'am.
All right, I suffer from terminal incomprehensibility, so please bear with me. I guess what bothers me more than anything else is that this is being pushed through so hard, so quickly, no committee meetings. And the natural reaction of people is to get their back up and say, am I being tricked? Why are you doing this to me? Now, one of the things that everybody's concerned about is the cost of medical care. And there's 2 large areas of costs that are not being addressed in this. Number 1 is tort reform.
Yeah.
Quite frankly, it comes across as protecting a big donor group. There's a handful of lawyers that are making a lot of money on outrageous settlements, and the cost just fed through the whole system, so they get very rich and all of us pay more. The second area of concern is government mandates on the insurance companies. We talk about increasing competition, and for some reason that's the government option. How about letting the insurance companies offer a much greater variety of plans? There's a lot of people, let them pick and choose what they want to be covered for. Don't force people to pay that they have no interest in being covered for, so it's affordable for them. And I guess I'm going to end up by paraphrasing a Canadian politician from 20 years ago, because I love this quote. It's a great place to use it. What the system needs is a blood transfusion. A blood transfusion, and you're giving us Dracula.
Your 6 questions one at a time. First, on the speed, I happen to agree with you that it's too important to rush. And in the Senate, we're moving along at a fairly slow pace. We're trying to get a bipartisan bill, and whether that will happen or not remains to be seen. But we have slowed it down. And it was slowed down in the House as well. The president wanted it done by the end of July. And it wasn't done by the end of July. And he understands the process because President Obama was a senator himself. on the I don't know how you get a big response about Senator Obama, about President Obama having been a senator, but that's reported. With respect to tort reform, that situation has improved a lot, but the bill hasn't been written yet. But I have to say to you candidly, there hasn't been a big push for it. When you come to the issue of what was your next one? Mandates. Well, that's where the rubber hits the road on whether you ought to allow insurance companies to write the policies the way they want to, or whether they ought to be controlled. And we've had, well, when you say the people want them, it's a matter of what risks the insurance company wants to undertake. And if they exclude pre-existing conditions, okay, then they can charge a lower premium, they figure. And if somebody wants to buy a policy which excludes pre-existing conditions, in a free society, they should be able to do that. But there's been a judgment over the course of the past 20 years that that's a condition which is too onerous on the people. And the people don't really focus on pre-existing conditions. Maybe you do. Maybe a really sharp buyer reads the fine print. Frankly, I don't know anybody who reads the fine print on these insurance companies unless you have a microscope and a lot of patience.
Or the bill. Sounds like Congress.
But at any rate, the judgment has been, and I think it's a sound judgment, that ought not to be excluded. Now then you have an annual examination. Companies do not offer an annual examination. Why not? Well, it costs money. And most people don't really think about it, but I believe it's a good idea to have a requirement for an annual examination, because if you detect cervical cancer early, you got a much better chance. They found my Hodgkin's early, and it was better. So we're trying to. I know you'd like to hear the answer to your question, and I'd like to hear the answer to your question. So that's what we're balancing, and we haven't made a decision on any of these matters yet. We're still working to write the bill. Who has number 4? Yes, sir.